So let's talk about hypoglycemic reactions with diabetes, okay? People that are diabetics, they're taking medications like insulin, and they end up with this low blood sugar situation. It's very common. 90% of diabetics using insulin have or end up with a low blood sugar situation, okay? So the medical solution to hypoglycemia is a complication of this treatment for diabetes. But if I had this condition, the question that I would ask would be, why is the blood sugars dropping down too far in the first place, okay? And the only correct answer would be there's too much insulin, because insulin is responsible for pushing the blood sugars too low, okay? So that would be question number one. Hopefully you would get an answer to that. So the next question I would want to ask is, why am I taking so much insulin if it's going to drive me into a hypoglycemic reaction? And why can't I take the least amount possible? Because the big side effect from insulin is damaged with the retina, with the eyes, with the macula, with heart, cardiovascular, with the kidney, with the nervous system. There's a lot of side effects from too much insulin. So then the last and most obvious question would be, how can I take the least amount of insulin or medication to keep my blood sugars normal and not too low or too high? And this is where we want to pull this book out right here, Merck's Manual, and let's see what they say about hypoglycemia, okay? Under treatment, it says, the single most useful treatment for hypoglycemia that follows meals is a diet high in protein and restricted in carbohydrate. Now that's some good advice, okay? I like that advice. Protein will instantly make you feel better instead of taking sugar. So that's one thing I would recommend. And they say restrict carbohydrate. That's awesome. But why don't they go on to say, diabetic patients taking insulin should always carry sugar lumps or candy with them, and the patient family and friends should be instructed to recognize the symptoms of hypoglycemia and giving the emergency treatment mentioned above. So here's the problem that I see. There's this huge focus and attention on managing this complication of hypoglycemia without focusing on the root issue, which is basically how can we take the least amount of insulin as possible and to the point where maybe we can even come off the insulin, okay? So the two things that I'm going to recommend would be to definitely lower the carbohydrates and eat less frequently. Now in the transition, you would want to add more fat to the diet so you could go longer. You'd want to do a ketogenic program. You would definitely want to do intermittent fasting, because that's ultimately going to bring your insulin down as low as possible. And just in summary, yes, I know you're going to feel better by consuming protein if you have low blood sugars, and you're going to feel better even if you have candy, because it's going to temporarily bring you up, but you're never going to correct this high level of insulin, which is dropping you into a low blood sugar situation. All right, thanks for watching. Hey, before you leave, I just wanted to give you a little quick history on some of the books that I wrote. This was one of the first books. It's called Dr. Berg Body Shapes. It was my attempt at writing about body types. What was very interesting about this book is I actually did all the images myself. Don't ask me why. They look actually not quite as professional as some of the images that I have in the new book. But anyway, this is my first attempt right here, called Dr. Berg's Body Shape Diets. And then I wrote a book more extensive called The 7 Principles of Fat Burning. I don't even have a copy anymore, actually, because it's outdated. The next book, I put about 1,000 hours into this one right here, called The New Body Type Guide. Major updates on the body types. I put a lot of energy into this. It has professional images, graphics, all sorts of things. Now, the problem with this book is it doesn't really describe what this is really about. Body types are only a small portion of what's in this book. And that's why I changed the name to the Healthy Keto Plan, okay? If you happen to have this book, you don't really need this book, because there's only very, very minor updates. But if you don't have this, you need to get this one right here. This book goes into every single detail that you would ever want to know about. It goes into the 7 principles of fat burning. It goes into hormones, the body types, the basic keto plan. It goes into intermittent fasting. I talk about the 10 fat-burning triggers and blockers and fat-burning strategies with a lot of details in every single chapter. I go into body issues that interfere with losing weight. There's very few people that just have a weight problem. They have a lot of body issues, whether it's sleeping problems, stress problems, inflammation, menopause. I cover that extensively in this book. Then I talk about how to get rid of stress, and I show you a technique. Then I get into exercising. And then I have a lot of really good recipes in this book as well. So this is a good reference guide. On my website, if you get this book, you get this one free. It's called Healthy Keto and Intermittent Fasting. This is the shortcut, quick guide to this book. And the reason I created this book is to have you, within 45 minutes, learn how to do keto, okay, in intermittent fasting, exactly what you need to do. Then you can fill in the blanks with this book right here. So right now I'm doing a special. If you get this book, you get this one totally free, or you can go to Amazon and get these individually. So I just want to clarify the difference between this book and this updated one right here. If you don't have this, you need to get this right here. That way you can get the exact correct information to do it healthily.